I don't think about it too much. Even that first story, what happens in the journalism world is, well, what are you doing tomorrow? You don't have time to bask in the glow or anything. There's none of that nonsense in the newsroom. It's like, well, what's your follow-up story in this? What are you going to do tomorrow? So I don't linger on that stuff a lot. I think you always have to look forward, and what are you going to do next that's better than what you've done so far?
That's the voice of one of Canada's most influential health journalists. He's been writing for the Globe and Mail since 1987, and he's the author of 5 best-selling books. We talked about the challenges facing Canada's healthcare system, music, running, the state of journalism, and much, much more. This is my conversation with André Picard. So thanks very much for making the time. So we're chatting on Bell Let's Talk Day. That's when we're recording this. It's going to be posted in a couple days, but must be a busy day for a health reporter. You wrote a piece that came out, I think it was yesterday. Bell Let's Talk is fine, but real action is needed for mental illness too. Talking about the fact that I think one of the lines in there was that when we ask people with mental illness, or when we tell them it's okay to be open and come forward, we also make an implicit promise that there's going to be help, and that's where we've fallen down. We've broken that promise. You want to talk a little bit about that, or what the thinking behind that was?
Yeah, so I've been covering this issue for many years, and for a long time, stigma was the big issue, right? We're worried about people wouldn't talk openly, et cetera. And that's changed quite dramatically in recent years, and things like Bell Let's Talk have helped contribute to that, to allow people to talk more openly. But I think at a certain point we have to say, listen, all this talking, what is it leading to? And what it's leading to is longer wait times for care, more frustration from people who, say, listen, I have depression, what are you going to do for me now? And we're doing nothing. So I think we have to move. It's not a bad initiative, but we have to follow through on that promise that, listen, if people are going to talk about it, that's not enough. They have to be helped.
And whose role is that? Is that government?
Yeah, I think it's principally government. We have to decide how we fund things more generally, but for now it's government. We don't fund mental health care very well, so some of it falls onto employers. So I think employers have a self-interest in doing it, in dealing with it. The biggest impact of mental health is on the workplace, on productivity. So it's in their interest to make sure their employees get care. And I think that was a lot of the drive behind Bell's initiative in the first place. So they have a responsibility, so does the health system, and so do we individually to recognize how we can help ourselves.
So you've been a staff writer at the Globe since 1987. What a great career. Well, not a lot of journalists get to work in the industry for that long, never mind for one publication. I'd be interested in your take on the state of journalism today, not only in Canada, but sort of, in North America. Obviously, layoffs, we saw, I think like 1,000 journalists got laid off last week, and newsrooms have been just slowly kind of decimated over the years. What's your take on where journalism stands right now, and how are you feeling about the future? Are you optimistic, pessimistic? What are you thinking?
Yeah, so things have changed a lot in the time I've been around. When I go talk to journalism students, I remind them I was there the days before the internet, before cell phones, before laptops, and that makes me sound like a dinosaur, which I am, but it's also, it horrifies them. They can't imagine, but it was a very different world. It was a world where our newspapers were much thicker. They were full of ads. The people who owned newspapers had huge 20% a year returns. It was, it was a license to print money. That expression has been used many times, and it's not anymore. And I think a lot of it was the industry itself was arrogant and fat and took changes in technology for granted, and we're paying the price now. So that's my background. As for the future, I don't know. I kind of feel like a horse and buggy driver who's kind of on the cusp of the car era, and I'm trying to figure out how to drive a car. I think we're all like that. So I think there's always going to be a desire and a need for information, and I think we have to figure out how to do it differently, how to monetize it. This era of where newspapers were free and they more or less, very token price, and they were paid for by advertising. That era is dead, and I don't think we've figured out yet what's going to replace it.
Right. So do you think journalism is a viable alternative for young people these days? I know there are programs obviously all over the country. Is this something, if one of my daughters said they wanted to get into it, I think it's obviously an important profession, probably more so than ever, but the employment prospects don't look great. What if you had someone ask you if they should get into journalism or not, what would your answer be today?
Yeah, so I get asked that all the time because I visit a lot of journalism schools. I visit a lot of medical schools where some of them want to write. And my answer is always the same thing, regardless of who I'm talking to, is I don't think that's how you make career decisions. I think you follow your heart, you do something you want, and you figure it out. So I don't think it's easy to get a full-time paid job in journalism. That's almost unthinkable now, but I think you can figure it out. I think you can do all kinds of things, selling articles, writing speeches. I think the new journalist is someone much more diverse than we were in the past, and much more innovative. You almost have to be an entrepreneur now to be a journalist, and that's not necessarily a bad thing.
My understanding, if I have any of this incorrect, please let me know, but my understanding is that you first got introduced to the world of journalism when you were at the University of Ottawa working for the student paper there, the Fulcrum. Is that correct?
Yeah, that's right. Yeah.
And so you had a bunch of different roles there. One of them, you were an arts editor for a while, you were the editor of the paper for a while, and you were a record reviewer. Is that correct as well?
Yeah, that's how I started reviewing records. So I serendipity. This is how I got into it, sort of in a backward fashion. And I was into music. I still am a lot. And I was actually studying accounting at the time. So I ended up sort of working my way up the hierarchy in the newspaper, mostly because student newspapers, you probably know, are always in financial trouble. We did that long before the mainstream media. We always had financial trouble. So, as an accounting student, I sort of ended up being the editor eventually. And because I was doing that, I had to write other things other than my beloved record reviews, and I kind of got interested in that. And yeah, so it's a circuitous path and not an obvious one. But again, it brings me back to what we said earlier. I tell people just, I think young people today are a little too uptight and worried about, what's my career going to be. They start thinking about it in kindergarten now. Mm-hmm. And I'm like, just, do stuff, read a lot, have fun. I think we put too much emphasis on what are you going to be for younger people. Even with my own kids who are now young adults, I'm still the same. So find something you like, and it'll work out.
Right. Now, you describe yourself as the horse and buggy guy trying to learn how to drive a car, but when it comes to social media, you were actually one of the first mainstream journalists to jump on the Twitter bandwagon. You were on early and you were prolific. I think you've got like over 100,000 tweets that you've sent out. What was it about that platform that kind of piqued your, what were the possibilities that you saw, and why did you jump in so sort of wholeheartedly so early?
Yeah, I think it's part of as I said before, during my career, there's been a lot of change, from the innovation of the laptop, the cell phone and stuff. And each time those things happened, I always took the attitude, well, let's try it out. And I've always had that same attitude, and I had the same one with social media. And when I started using it, I think I recognized early that this can really be beneficial if you use it properly. So for me, Twitter, I spend an inordinate amount of time on Twitter, but it's really become my news feed. So that's how I read news. I used to be a person who had a stack of 10 newspapers on my desk in the morning, and now I have my Twitter feed. And people say, you spend a lot of time there? And I say, yeah, I used to spend a lot of time leafing through newspapers. So to me, it's not the time suck that people think it is. I think reading and being up to date is part of my job, and I just do it in a different and actually more orderly way now.
Do you miss anything, though, about the newspapers stacked up on the desk?
Oh, absolutely. I miss the serendipity, like leafing through and, look at this article, about Chinese pandas or something. And now we tend to be much more focused and hyper-specialized. Like I only tweet health stuff, and I tend to almost only read health stuff now. So I've lost out on some of the just stumbling across things by accident and reading them, and that was always a pleasure.
Do you think we lose something too in the sort of short form and just getting obliterated with information, the 280 characters and just coming at you all day long? Is there something that we miss with that?
Oh, I think we just don't read anymore. I think, I'm as bad as anyone else. I start stories and then, squirrel, there's another story,
ADD.
and off I go. Yeah.
Jeez.
And, with the newspaper is different. There's a little block, and you said, there's the beginning and the end, and you tended to plow through it unless it was horribly written. But I think we just have a less of attention span, and the medium lends itself to that, to not being engaged.
How much of your job would you say is, because you're a columnist, right? You get to basically decide what you want to write about. And having done this so long, how much of your job would you describe as fighting the kind of misinformation that's out there?
I think that's a part of the job. I always tell, again, when I go to journalism students, I always tell them that what I don't write is much more important than what I do write. So I think making those choices is important, like not to amplify nonsense and not to, just be predictable and knee-jerky about things. So I think I'm not fast on the draw. I often wait a couple of days to weigh in on a topic. Mm-hmm. And I think maybe that makes me old-fashioned, but I think that's more important to have a thoughtful take than the first take.
The one that comes to mind when you mention that is the study that came out. I think it was from the World Health Organization about bacon. And the headline was basically, there was a body of research and it came out, and the headline's basically bacon causes cancer. And your take on that came out a couple days later, I think the headline was go ahead and have a BLT for lunch. Is that sort of that kind of thing in action?
Yeah, I think that's a good example, although that's a really good example of a good headline writer. We have to give a shout out to our editors sometimes. They do important stuff like that, think up catchy headlines. But yeah, I think that's part of it, is to say, the thing we do worst in journalism and worse than we've ever done is provide context to people. So often that's what my columns are. They provide this context. And what that column said essentially is that, everything causes cancer to a certain degree, and we have to keep things in perspective and recognize the proportion. So eating 2 pieces of bacon a week, is that going to give you cancer? Well, theoretically, yes, but, in real terms, no. Don't fuss about that.
Right. There was a similar one, not content related, but one of the ones that comes to mind to me was the Gordie Howe situation when his family, he was not doing well, and they had stem cell treatments done, and they talked about the results that he had, and it was, I think people were really happy to jump on that story because it was such a feel-good story, and they were using words like miraculous, and I think you had a piece that sort of tempered that a bit, like, yeah, this is great to see, but let's not get ahead of ourselves here. That's got to be a delicate line to walk, especially when you have someone who is as famous and revered as a Gordie Howe. So there's a certain sensitivity that takes. How do you kind of figure out where that line is?
Yeah, I think you have to, you base it on the information, on the evidence, and you go with that. And in something like that, you're going to take a few hits from the elbow from his fans, and you live with that. And I think that's what you have to do. You have to say, not be taken in by that celebrity stuff, and just reiterate what I always say, which is, anecdote is not evidence. It's great that Gordie Howe's doing better, but is it really this, or is he just doing better? And, that's a hard thing in health overall. We have to, if you read enough healthcare, you realize how little we actually know. So, after 30 years of reading this stuff, I realized we just know a lot less than I thought we did before I knew anything. And the reality is most conditions are self-resolving. The body's a pretty amazing thing. And sometimes we speed it along, sometimes we make it worse, but we have to realize that we really have a lot of limitations, and, we don't often do a lot of good for all the money we spend on medicine.
You use the word evidence, and everything I read about you, that's the word that keeps coming up. They said that certain people will write opinions, or certain people will amplify that sort of tinfoil hat story that comes out across the headline, but they'll say that André Picard is a guy who writes based on the evidence. So would you say it's kind of opinion based on evidence, or what role does that evidence play in your writing?
Yeah, I think it's essential. I think it's really easy to have a knee-jerky opinion, and you can knock those columns off fast. I really like to have a lot of data in my columns, maybe too much for some people's liking, makes them a little dull, but I think it's really important to back up your opinions. And that way, I think the best compliments I ever get from people are, I don't agree with you, but what you read, what you wrote was pretty convincing, but I don't agree with you, but I think you have your facts right. And that's, you're never going to convince everyone, but I think if they recognize that you're fair and you stick to the facts and you're not partisan, I think people will give you a lot of time.
So with 80,000 and some followers on Twitter, I'm sure there's got to be a fair number of trolls in there. Like, do you get into the comments or not? And if you do you have like a thick skin, or what's your philosophy on trolls?
Yeah, so I do have a thick skin after all this time. I recognize that I'm privileged. I don't get the abuse that, say, young women journalists get, which I think is just sickening. So I don't get it as badly as others. I recognize that. I interact a bit. I actually interact less than I used to because I just found it wasn't very useful. So there's no point engaging with someone who's just a dogmatist. So I don't bother. I don't really block. Well, I don't block people. I'll block, anonymous eggs. If you're not going to put your name to something, I won't interact at all. So the comments, I don't really read the comments associated with my stories in the paper, and I always tell people rule number 1: don't read the comments. But if people email me personally, no matter how angry they are, I try and respond to everyone who takes the time to personally contact me, even if it's to say, I guess we have to agree to disagree or whatever. I try and take a moment, but I don't do that with every single tweet, obviously.
Right. So I heard a story about how one of your first healthcare stories, I guess, you were working for the Globe. I don't know if you were an intern still or if you were on staff, but they asked you to go to St. Mike's to look into a story about a patient who was being mistreated. And when you got there was a patient who had AIDS, and there was a sign there telling people, like warning them to stay away from this guy because he was contagious. And my understanding of how the story goes is that you walked up to this guy and extended your hand and kind of shook his hand, and the guy burst into tears. Can you talk a little bit about that day, and what role did that experience play in you deciding that you wanted to go into healthcare journalism?
Yeah, so I relate that story actually in my new book at the beginning of my book. And this patient had AIDS, and at the time there was no treatments. There was a lot of discrimination, et cetera. And that story was impactful to me. But I said hi to him like I'd say to anyone else. It wasn't anything thoughtful. I wasn't being brave. I wasn't Princess Diana reaching out to the AIDS patient. To me, it was just a normal person. And at that time, I was covering, by default, I think I still was a student at the time, but I was covering a lot of AIDS stuff. And AIDS at that time was not getting a lot of attention in the mainstream media yet. So I was covering a lot of protests and stuff. So I met a lot of people, interacted with them, and you come to realize that, hey, they're just like us, like anyone else, and they have an issue, and that's how I felt about this man in the hospital as well. So it was more afterwards when, you get this. It was one of the first stories where I wrote the story, and then there's an immediate impact. Like as soon as the Globe hit the doorstep, and this was in the pre-internet time. Mm-hmm. So first thing that morning, it hits the doorstep, and I imagine the CEO of the hospital and whatever, and bang, that guy's, his room hadn't been cleaned for days. His food was left outside. It was he was treated in an appalling way. And, within minutes of the Globe hitting the stoop, that changed. They cleaned up his room. They apologized to him. They introduced a policy for treating AIDS patients. And, St. Mike's is one of the premier AIDS treatment facilities in the world now. And it's not because of my story. I'm not suggesting that, but I'm suggesting that, it's stories like that that open people's eyes and change policies, and you realize, wow, this is a good job to have. You can make a difference for one person and for an institution, and that's what stuck with me more than the encounter itself, is having an impact, and the importance of choosing your stories and thinking them through, and what impact they're going to have on people.
That's good. That had to be a great feeling though at the time, and especially I think you're like a year into your career. And that switch that gets kind of flipped in your brain saying, wow, I can actually help affect change here because, but for that story, who knows how long that would have gone on, right? How much of that kind of gravity or that sort of, power is not the right word, but that ability to shine the spotlight, how does that weigh on you? Because as you've progressed through your career and you get more profile and the awards and everything else, when you decide to shine that spotlight, it gets a lot of attention. So how does that weigh on you when you're deciding what to write about?
I don't think about it too much. Even that first story, what happens in the journalism world is, well, what are you doing tomorrow? You don't have time to
Right.
to bask in the glow or anything. There's none of that nonsense in the newsroom. It's like, well, what's your follow-up story in this? What are you going to do tomorrow? And when you do one story like that, you get 10 calls from other people who feel they've been treated unjustly as well, and you got to sort through those. So I don't linger on that stuff a lot. I think you always have to look forward, and what are you going to do next that's better than what you've done so far.
Right. And what are you thinking, right? Like, what are you working on right now? What are you without give us any scoops on any of your columns that are coming up, but what do you think are some of the things that are bothering you about healthcare right now in Canada? Things that are, as we're obsessing about the Kardashians or whatever the latest Instagram post, what are the things that really should be getting attention and aren't? Like, if you could say, here are the 3 or 4 or 5 things that the public should be looking at and reading into, and the government should be focusing on, what are those things?
Yes, I guess the biggies for me, I focus a lot. I don't really write about medicine. I write about health policy and healthcare delivery. So I obsess a lot about the impact of the aging population. How are we adapting our system to that? And we're doing it terribly badly. We created. I'm very interested in history, so I talk a lot about Medicare history. I weave that into my columns a lot. Often too much for my boss's liking, but that's another matter. But, I think it's important to learn from our history, and we created this Medicare system in the 1950s to suit the needs of the demographic at the time of the baby boom. And now we have this baby boom that's old, and we just haven't adapted our system. So I kind of obsess about that. We have to really change the fundamental structure of the system to suit the population. So that's probably what I write about obsessively. And then related to that, there's a lot of things. How are we going to, I often wonder, and I stay up at night wondering about this. How does Medicare, which is a program for the masses, it's public insurance, how does Medicare function in a world where we have individualized medicine? And that, I think that's the next big challenge that we have in policy. Is Medicare still viable in a system where we treat people with really personalized medicine? So I think there's some big questions coming, and we have to really give some thought to them.
Do you think the word crisis is overblown? Like, there are people that I speak with in the healthcare sector who say that if we're not there now, we're going to be there soon. The population is aging, the population is growing, everyone's living longer and more chronic diseases. Hallway medicine and long-term care homes are stuffed and waiting lists. And this doesn't seem like it's going to be getting any better. We can only crank out so many doctors and nurses, and some of them are actually leaving the profession. So without being too doom and gloom, would you say we're dealing with a healthcare crisis here and people just aren't aware of it? Or is that kind of too grandiose?
Yeah, I never use that word. I think it's overused and not appropriate. I think we have the basis of a really sound system. I think I think it's really important to remember that when you're in the right place at the right time, you get superb care. So we've got all the elements there. I think we've dealt with much larger problems in the past than we have now. I think we just have to, it's about getting the puzzle pieces in the right order. I think that's what's wrong now. We have all this stuff and we just don't, it's not just fitting together right for the current time. So unlike many journalists, I'm actually pretty optimistic about the healthcare system. I think we can, one of the main reasons is I know that we've solved every single problem that we have at least a dozen times, right? So we're the land of pilot projects. So we tackle these issues, and we've tackled every serious issue in a good way on a small scale. And the real problem we have is a leadership problem and scaling up. So that, to me, is where the solutions lies, to take all the stuff we know and implement them. And that's, that doesn't necessarily cost more money. I hate hearing about, the crisis of the gray tsunami. I think that's utter nonsense. Whenever I get the opportunity to talk about this stuff, I always remind, the fact that people are living longer and better than ever before, how is that in any way a bad thing? Mm-hmm. It's not. It's amazing. And some of that, the credit for that goes to our healthcare system, not very much, but a little bit of it goes to the health system, and we should adapt that health system to this new graying population. 85 is the new 65, right? I know a lot of healthy 90-year-olds who tweet me every day, and that's the new reality. We forget that at any given time, there's only about 8% of the population is involved in the health system in any way. 92% of us are fine all the time. So, that's the kind of perspective we don't get. We get caught up in the so-called crises and the problems, and we forget about all the good stuff.
We hear more about the other stuff, though. We hear more about the sort of crises type things. There's not a lot of the good stories out there, right? Like, I think journalism, in general, we tend to focus on the dumpster fires, don't we?
Oh, absolutely. And, I always remember my first boss at the Globe, whenever you'd kind of pitch something positive, he'd say, the sun rising is not news. I don't want to hear about that.
If it bleeds, it leads.
And that's yeah, and I think that's still the overwhelming attitude in our business, and I think that needs to change a bit. And I think it's not totally appropriate in some areas, and healthcare is one of them. That's fine if you're covering the courts. Of course, you're not going to cover people who didn't murder their spouse. That's not story. But I think in healthcare, it's a bit different. We have to have a different approach.
So I'd like to get your comments or sort of context on a quote from you. People's income or lack thereof has twice the impact on their health as their cancer does. Why is tackling poverty not a health priority?
Yeah, so that's, again, something I write about a lot, is the so-called social determinants of health, to use the jargon of academia. But, that's the reality, and I've alluded to it a few times in passing, that what keeps us healthy is not medicine. Medicine is for when you're already sick. So what keeps us healthy is having a decent income, a roof over our heads, a good education, a sense of belonging, good food, all this stuff, and we've known this for 200 years, and we just don't act on it. So to me, I actually think we spend far too much on sickness care, on our so-called healthcare system, which is actually a sickness care system, and we spend far too little on things like income supports, social housing, giving people more accessible, affordable food, creating community centers so people can interact. I've become in recent years really interested in this, on the impact of loneliness, and it's dramatic. It's as bad as smoking for your health. So these things they seem esoteric, but they're really, really important to our health. And we've created this system where we wait for people to get sick, and then we spend a ton of money treating them, and we have really limited treatment options. And the prevention options we know are much more effective, but you have to do them early, and you have to do them often, and you have to really invest. So if you take a country like Canada, we spend about 11% of our GDP on health, and we spend 13% of our GDP on social programs. But a country like Denmark, they spend 27% of their GDP on social programs, and they spend about 9% of their GDP on health. So that, we go, wow, they have better outcomes and they spend less on health. Isn't that amazing? No, it's not amazing, because they prevent a lot of people from getting sick by spending elsewhere.
I was going to ask which countries, and you just mentioned Denmark, but are there countries that Canada should be looking to for examples that come to mind?
Yeah, I think there's no, you often get asked that question. There's no perfect system. So I actually once wrote a column about this. What would the perfect system look like? And I have a list of, it would have the social engagement of Brazil, and the drug program of Israel, and I forget what the list was, the social programs of Denmark, et cetera. But there is no perfect system. Everybody in every country I go to whines and moans as much as we do about how bad their system is. And the reality is we can all learn from each other. The disease we have in Canada is we always look to the U.S., and we look to the U.S. and it's a total train wreck. It's not a system, so I don't think we should compare ourselves to it. It is in no way a system. And then we take comfort. Well, we're better than, maybe we wait 45 hours in the ER, but we're better than the U.S. And I say, well, why compare yourself to that? Compare yourself to the Netherlands or Denmark or France. And none of those are perfect, but they do many things better than us, and we do many things better than them, and we can learn from each other. Now, the difference is they come and learn from us and they implement it, and we don't. So I take the famous report in 1974, the Lalonde report. Mark Lalonde was the health minister at the time, and that was really a groundbreaking report about what we just talked about the social determinants of health, how we should spend on social welfare as opposed to sickness care. Really innovative, forward-thinking, brilliant report. Sweden, Norway, Finland, they all implemented the recommendations of that report. Canada didn't. So, we wonder why we are where we are today.
So your book came out, I think it was, 2017 or 2018, Matters of Life and Death. Compilation of some of your columns. I'm not sure how to describe, how would, of the many or maybe thousands of columns that you've done, how did you decide which ones to put into this book?
Yeah, it was something I hadn't given much thought to before I did it. I thought I could do it quickly, but it actually took a long time to figure out. So I think what I tried to do is get a variety of topics. You realize that a lot of columns you write are very time sensitive. So if, I had a column, Stephen Harper was a bum last week when he did this, all those fall by the wayside because they're not appropriate 10 years later. But then you realize there are some, so when I was going through, I think there's like 800 or 850 columns that I had written, and I tried to weed it down. There's about 80 in the book. So I realized, so first you eliminate those. There's a good number that's just not going to bother with that. That was very time sensitive. And then you start going through the other stuff, and you realize I have a column in the book about the abortion pill. And I realized I had done that 5 times over 25 years because it took us, Canada, 26 years after France to approve that drug. And you kind of go, wow, that's pretty sad. But so I take those 5 and I sponge them into one, I edit them a bit and make them into one column,
right,
et cetera. So then you do that. And to me, the important thing was to get a sense of the variety of stuff I write about more than anything.
Mm-hmm. Any plans for a new book in the next couple of years?
I always sort of have something on the back burner. It's not a big priority for me. A book takes a lot of time. It actually, you essentially lose money on a book. If you break even in a Canadian book, you're doing well. So that's my goal now, I'll break even. So I have an idea for a book, but I'm not sure if it's, my publisher's keen on it, but I'm not sure if I want to invest the time and energy in it to do another. Sure. So I'll see. Yeah.
Do you get edited a lot these days? You've been in the business for so many years. When you write something, do they publish it as is, or do you still have somebody giving you notes? And is it somebody who's 20 years younger than you? And what does that process look like? Because I know sometimes it kind of ruffles people when they get edited.
Yeah, it doesn't ruffle me at all. I would be happy to be edited more. So, one of the big cuts in our business is getting rid of copy editors and people like that. So I think we could all do with a lot more editing. And I miss that. I had the same editor for a long time, and he was great. And I could, I think the most important part of editing is the upfront part, like bouncing off ideas. I'm thinking of this, and I'm thinking of this angle, and I have very little of that back and forth now. We just don't have people who have the time to do that. So so I miss that part. Now we have people read over, typos. They say, oh, I'm not sure what this sentence means. Do you want to reword it? And I welcome that stuff. And again, I think there could be more of it. There's nothing I hate worse than when I see something in the paper and I go, oh, that reads badly. Why didn't someone catch that? Or, you have a name of a person and it's spelled differently 2 different places. That should never happen. 5 people have read over it and you're like, and then of course people are tweeting you, oh, you don't know how to spell this guy's name. And they're right,
It's so funny. So obviously we're doing this is audio. we can't see each other here and we're not in the same room. But the pictures that I've been seeing of you online, you've got something going on with your beard. It seems to be getting bigger and fuller. Is this your David Letterman phase?
Well, this was the Christmassy Santa beard, and I just haven't gotten rid of it because it's been 30 below. So we'll see. We'll see where it goes.
It's a little chilly out. What do you do?
I'm keeping an eye on Letterman there. You might catch up to him.
He still has his, I think.
Yeah.
That's a big beard. What do you do in your spare time? I know you do running. I don't know if you're still into that, but what is when you have some spare time and you're not writing, how do you occupy yourself? What's fun for you?
Yeah, so I'm a runner. I travel around. I like to run in different cities, so that's fun. I, like most people today, probably watch a little bit too much Netflix. I like to read. I've just been judging a book contest, so I just finished reading 49 Canadian nonfiction books over the last couple of months. So I do lots of reading of books. People send me books constantly, which I'm lucky for, but I can't keep up with them. When I read for pleasure, I like to read murder mysteries. Nordic murder mysteries is the thing I do for relaxation.
That's very niche. Nordic murder mysteries.
Yes.
What is it about the Nordic? What is that? What's the allure?
Well, I think I like the I don't know, I guess the philosophy undermining it. So if you read American murder mysteries, the cops are always going to end up sort of busting down a door and shooting someone, right? And the Swedes and Icelandic people, their cops don't carry guns. They have there's not a gun-related society, so they're much more psychological, and there's much more angst in there, and much more, I think, more real people. There's more women detectives. It's just sort of a reflection of their society. So I find it more rich and more interesting.
You kind of piquing my curiosity here. So if you were going to recommend one to be like my first Nordic murder mystery, this sounds so niche. What's the title that comes to mind?
Well, you have to go with the top of the line. You have to, if you're picking one, you have to go with Joe Nesbo. So he's the god of Nordic murder mysteries.
I've actually heard that name. Yeah. That's great.
Yeah. So something like he has one of his recent books is out as a movie, so it's called The Snowman. Very timely for this time of year, so that I would recommend that one. I'm really into Icelandic murder mysteries these days. Iceland has the biggest proportion of writers per capita in the world, so really? 1/10 of Icelanders have written a novel. So believe it or not. So 1 in 10 people has written a novel, and I love this. There's a murder mystery writer called. Now I'm going to mangle her name because I could spell it because I'm a print reporter, but I don't know if I'm saying it right. But it's Yrsa Sigurðardóttir. They have very long names, and she has a whole series of really, really great murder mysteries set in Iceland, in Reykjavik.
Excellent. Well, thanks for the tips.
Yeah.
One of the more sensitive things to write about is obviously suicide, and you wrote, I think it was a column last year after the sort of back-to-back suicides of Anthony Bourdain and Kate Spade. The philosophy around covering suicide has changed from the old days. And I remember even when I went to journalism school in the early 90s, they told us you don't write about it. Like, it was day one. It's like, tell both sides of the story, get proof, like, don't just go on one source, and we don't write about suicide. And the old thinking was that when a story would show up in the media, that there was copycats and people would sort of get the idea from it, and then you'd see a spike. How has that changed, and what do you think the benefits and harms are of covering suicide in the media today?
Yeah, I think it's changed a lot, and I think for the better. I think there is, in our newsrooms, there is a stunning amount of hypocrisy about this. We would use all these euphemisms, so-and-so died suddenly, and we wouldn't say that, and there was a time, actually before my time in journalism, it was actually illegal to kill yourself, right? Which seems like an absurd law, but so, you didn't want to suggest that someone was bad because he had tried to kill themselves. So there's all kinds of societal taboos. There's all kinds of religious interdictions that influenced our thinking. We're a very Catholic paper, et cetera, and there was a mindset across Canada. So that's changed quite dramatically. And my view that I developed over the years in meeting people, and my view changed by meeting people who had survived and people who had lost kids to suicide, who were frustrated. They'd say, why don't we just write about this like everything else? And that's the attitude I take. If I'm writing about a murder, I'm writing about a suicide, it's going to be the same thing. Try and be sensitive, but I'm going to give the details. I'm not going to bullshit people. I'm not going to use euphemisms. I'm not going to beat around the bush. I'm going to say he killed himself, and and that's that. And there should be no shame in that. Almost 90% of suicide has a background of mental illness. So this is like a symptom of a disease. So if someone, from cancer loses their hair, we write that. If someone who has schizophrenia kills himself, we write about that. Those are facts. Mm-hmm. And I think that attitude is taking hold, and I think that's good.
Do you listen to podcasts at all? I know it's obviously we're on one right now, but are you a consumer of them?
I do it sporadically. Sometimes I do. I haven't of late because I've been reading all these books for the contest.
The 49
but
books.
I listen to. Yeah. So I listen to them sporadically, but I'm not an addict like I know some people are podcast addicts. I'm not quite there. But and I like more lighthearted ones. I like things like Dan Savage Love, and things like that that are entertaining.
So. Oh, cool. When did you get into
and
running?
Warren Weeks, of course.
Oh, yeah, of course, yeah. When did you actually get into running originally?
Well, the running came in two phases. So I ran a lot in high school. I was a skinny little kid, so I was made for running, not football. So I did a lot of running, but that was back in the 70s when we lived in the no pain, no gain era. So we grossly overtrained, and it was, if it was pleasant, then it wasn't good running. It had to be unpleasant at all times. So I kind of fell out of that. Once you were freed of the bonds of high school, I stopped doing that for a long time. And then I got back into it after my kids were born, and I was trying to lose my pregnancy weight.
So how often do you...
I say that semi-jokingly, but
no, I know. Hey,
put on as much weight as women.
I know, I get it.
And the difference is women lose it after they give birth, and the men don't. So
That's right.
You have to all change.
Well, that's called dad bod now. It's apparently highly coveted these days.
Okay.
So do you do like, is it just you run, around your neighborhood? Do you do actual races like 5Ks, 10Ks, that kind of thing?
Yeah, I've run marathons for a long time. So I've done about 75 full and half marathons.
No way.
And
That's amazing.
So I run with a group of old guys like me, and we get together for race weekends, and we'll run a marathon, and we'll go to a sporting event. We'll go to a football game or a basketball game, and we choose our locations based on where we can do this fun stuff, and running is fun, and yeah.
What's the coolest marathon you've done, or the one that kind of stands out in your mind?
Oh, I've done many all over. New York, of course, is very memorable because you run over all the bridges, and it's 48,000 people you're running with, your 48,000 closest friends. So that one is memorable. I'm a little too slow to run Boston, so I've gone to see my friends run Boston, but I haven't qualified. I'm too plodding for that. I really liked. We ran a marathon in Eugene, Oregon, which is where Nike is based, and where Prefontaine, one of the most famous runners in history, that was where he was based. And so you run the beautiful course in part of it in the woods in Oregon, and then you finish in the famous Oregon Duck Stadium. And at the entry of the stadium, everyone pauses and touches the foot of the pre-statue for luck, and then you finish your lap around the track where all the Olympic trials are run. So it's got a lot of really good history to it. So that one was really fun. That was probably my most memorable one.
Wow.
But, Canada has beautiful marathons, Victoria, Vancouver, Montreal, Toronto. We have really nice courses. So, yeah.
If I were you, I'd be like selling that a little more. My Twitter bio would be me, with medals around my neck, and I'd have that in my bio. Like, I had no idea you've run that many. That's great.
Oh yeah, but I would just get shamed by the guys who are much faster than me, so I wouldn't dare do that. I fully admit I'm a plodder.
So what benefits do you think you get from running? I've got a group of people who've been trying to get me into it very reluctantly for a couple of years. So what is it? If you get a period of some time where you haven't run, what do you find? Do you feel it in your head, in your body? Like, what is it that you get from it?
Yeah, I like that it's the time that I go without my phone, so I'll go off for a run for an hour or two and have no phone. I travel a lot, so I love that. That's a good way to see other cities. Running routes tend to be the most beautiful parts of cities, so if I go to a city, I usually go to where the water is, and there's usually running paths along the water. So you see really nice stuff, you meet nice people, and I think it's most important for me mentally. I think it just relaxes you and allows you to turn off, plug in my iPod and listen to music, and off I go. And then when I run on weekends, I run with a group, so you meet people of all ages, and you just get together. I often go to the running room has these free run groups, so I'll go to whatever city I'm in. I'll often just go to the running room, and I'll meet new people and run with them. And there's sort of a community of runners that you welcome anyone. If you don't know them, it doesn't matter. They join your group, and off you go.
What are some of the songs on your running list?
Oh, I listen to all kinds of stuff. I listen to sort of as we said at the outset, I was big into music way back when, so I still like my 70s, 80s music, but I love to listen to a lot of rap. I'm really into Kendrick Lamar these days. I think he's a brilliant, he won the Pulitzer Prize for his work, and I think he's a brilliant artist, so I listen to lots of Kendrick these days, and then some of my older stuff, etc. So, but I'm always looking for new music. I'm kind of keep up to date on my music.
Mm. And how do you find running has changed for you over the years? Are you running less? Are you running more? Is it stretching? Like, how do you kind of stay in shape as you're getting older?
Yeah, it just goes in waves. Like these days, I'm not running a lot, and that's why I run with this group. Is we plan races, and then you have to get into a training program so you don't humiliate yourself in front of your friends. So it goes in waves. So it depends on what I'm planning run-wise. I'll say if I'm training for a marathon, which I haven't done for a couple of years. I'm doing mostly halves these days. But if I'm training for a marathon, you have to seriously, you have to really do like 50, 70, 80 kilometers a week, so you have to plan it out. So I'm a planning person, so I'll plan out my program. And when I don't have a race, I'll just sort of do whatever. It's nice out, I'll go for an hour, or I'm in a rush, so I'll go for 20 minutes. So it depends. Yeah.
You're from North Bay originally, right?
Yes. Who's asking?
Yeah, I don't have any of your high school buddies on the line.
There you go. I was just listening yesterday to Q on CBC, and they had a fellow North Bayite who's written this murder mystery series called Cardinal, which you may have seen on TV, and he's from North Bay, and it's based in a fictional North Bay. So we were joking about that last night with friends about that very issue, how many murders there were.
That's right. Well, I'm originally from the Sioux, and so I feel this kinship with folks from the North who apparently never, we always leave our cities and sort of, you go to school and you never make it back. Do you ever make it back? Do you have any family or people there or not really?
Yeah, I still make it back. My parents were always there, so I made it back a lot more often when they were alive. Now I have a brother there, so I go a few times a year and visit him. My kids were brought up in an urban area in downtown Montreal, but they love going there. That's kind of exotic for them. It's kind of funny because, you grew up in the North as a teenager, you're desperate to get out because it's so boring. And then these kids who have everything, all the benefits, they think, oh, it's so cool, you can walk to the lake. And they go, just try living here. You wouldn't be as enthusiastic. But so it's interesting to see that change.
So I know you've got to run. I've just got one last question for you. I'd be curious to know, given your experience in journalism and the number of years you've been in it and the number of stories you've worked on and the ones you've read, what's your critique on the way that stories are being covered today, particularly by younger journalists? What would be, if you could give just generally people who are in the trade a piece of advice to have better stories, better outcomes, what would it be?
Oh, I always give the exact same advice, and it's 3 words. It's take a breath. Like, I don't know we're always in a hurry. What's the rush to get the story done first? I've never understood that. I never understood the notion of a scoop. I could care less if I get a story first. I'd like to have it to be readable. I'd like it to be thorough. I'd like it to be accurate. I don't give a shit about how much. I guess I can't say that on podcast.
Oh, you can say it for sure.
Okay. Well, I don't care how quickly it's done. So I think that's the most important thing. Take a breath, get more detail, sit down and think for a minute before you start typing. I think those are things we've stopped doing over the years. I used to when I started, we had a deadline at 6 p.m. and the newspaper was printed the next day. We could go as late as 10 if it need be. And there was none of this 24/7 deadline business. You could actually go do your interviews, go out for lunch, think it over, chat with your colleagues, get feedback from your editor, how you're going to do it, and then actually write. We used to write much better stories because of it. Now we just produce a lot of crap. We just churn it out. And, who benefits from that? No one.
Valid. Well, I want to say thank you very much for your time, André Picard. All the best to you and yours for the rest of 2019. Thank you so much for taking the time. Really appreciate it.
Thanks.
All right. All the best. Thanks once again to André Picard for taking the time to speak with me. I hope you enjoyed our chat. I encourage you to follow André on Twitter and to check out some of his books, including his most recent, Matters of Life and Death. If you enjoyed this episode, please subscribe to the show and or leave a comment on Apple Podcasts or a review. It's a great way to help other people find the show. Thanks again for listening, and we'll see you next time.